بسم الله الرحمن الرحيم. Now we will discuss endometriosis and adenomyosis. So what's endometriosis? Endometriosis, it is the presence of endometrial tissue outside its normal location, namely the lining of the uterine cavity. The ectopic tissue retains the histological characteristics and biologic responses of uterine mucosa. يعني شنو؟ يعني نفس النسيج اللي موجود هو اللي مات الاندومتريوم راح نلقاه خارج مكانه الطبيعي. شي يصير تغيرات اندوكراين، راح يصير تغيرات، يصير شيدينج، يصير جروث بالاندومتريوم. نفس التايم هاي التغيرات راح تكون تجري على نفس التشو اللي هو outside the uterus. اوكي مفهوم؟ The prevalence more predominant in reproductive years estrogen dependent. يعني أكثر شيء بالفترة اللي إحنا عندنا استروجين متوفر. High prevalence in infertile women 20 to 30%. Found in all races and social groups. It is a disease of high social class. ليش disease of high social class؟ لأنه عندهم delay marriage. التايبس عندنا ال A اللي هي extrauterine external endometriosis، وعندنا uterine internal adenomyosis نسميه. ال extrauterine هي means ectopic endometrium. pelvic commonly نشوفه وين؟ راح نشوفه بالovaries أكثر شيء. uterosacral ligament نشوفه posteriorly. pelvic peritoneum. recto-vaginal septum أكثر شيء downward، ولهذا راح نشوف عندهم هسه بعدين بالساينال symptoms نشوف عندهم dyschezia. less commonly نشوفه بالبول، urinary bladder، mucous membrane، نشوفه بالسيرفكس والفاجينا والتيوبس. عفوا. الإكسترا pelvic نشوفه بالسكين، lungs، stomach، sciatic nerves. اليوتراين اللي هو internal adenomyosis يعني معناها هنا راح نشوفه، لكن هو مو outside the uterus. Etiology. The exact cause is unknown. Disease of theories. يعني شنو؟ يعني كل النظريات السبب الأساسي هو غير معلوم. نشوف النظرية الأولى اللي هي retrograde menstruation Samson theory. شنو الإثبات؟ It is the most popular. Fragments of shedding of endometrium regurgitate along the fallopian tube to be implanted upon the peritoneal surface of the pelvic organ. يعني راح يرجع البلاد لورا، راح يكون وين؟ يروح على surface of the pelvic organ. Supported by endometrial cells found in peritoneal fluid during menses or early follicular phase. شافوا هاي الانdometrial cells موجودة بالperitoneal fluid. بعد endometrial cells found in most dependent portion of the pelvis. بعد endometrium from menstrual blood can grow if injected. شافوا هذه الانdometrial cells ياخذوها من المنسول blood يخلوها يسووا لها injection، راح يشافوا راح يصير بيها growth. The obstruction of outflow increase retrograde menstruation راح تسوي لنا endometriosis. Shorter cycles and increased duration of menses are associated with high risk. شافوا ذول shorter cycles اللي هي تتعرض للاستروجين، شافوها أكثر هذه السايكلز يكون عندها associated with high risk. هسه عندنا الثيوري الثانية اللي هي lymphatic Halban and vascular theory Russell. Supported by endometrial tissue present in lymph channels, pelvic nodes, and also pelvic veins. It explains embolization to distant areas outside the pelvis. هذه راح شافوا endometriosis مناطق بعيدة بسبب الليمف vessels. السيلوميك metaplasia theory. هاي الثيوري اللغة الثالثة اللي هي Meyer theory. The peritoneum is developed from the same embryonic origin as the uterine mucosa and thus has the power to undergo metaplasia. شافوا إنه هذه لأنه من نفس الامبريونيك أوريجين نفسها راح عندها القابلية إنه هي تسوي metaplasia. Coelomic epithelium with adult cells undergoes differentiation to its primitive origin and then transform into endometrial cells. What induces this transformation is unknown. ما حد يعرف ليش يصير هذا الترانسفورميشن. بعد عندنا الإندكشن ثيوري. It is an extension of coelomic metaplasia theory which processes an endogenous undefined biochemical factor which can induce undifferentiated peritoneal cells to develop into endometrial tissue. بعد عندنا هي genetic and familial factors. Through multifactorial inheritance, it is 7 times greater first degree relative as endometriosis. شافوها. إذا عندنا أحد بالعائلة، أكو أحد بالعائلة عنده endometriosis، راح تكون 7 أضعاف إذا first degree relative has endometriosis، راح تزيد القابلية على endometriosis. Immunological theory. Immune system may be altered in women with endometriosis, decrease the clearance of viable endometrial cells from the pelvic cavity, supported by antigens from degrading endometrial proteins, produce peritoneal irritation and fibrosis. شافوا أكو fibrosis باللابروسكوب. Endometrial antibodies are discovered with high incidence. Endocrinological aspects of endometriosis. The response to both endogenous and exogenous estrogen and progesterone is in similar manner to that of normally sighted endometrium, although the response is less profound, finally shedding, internal menstruation. The endocrine disorders that may be associated with endometriosis are anovulation, hypoestrogenemia, and PCO. Disordered prolactin secretion. شافوا عندهم increased basal levels. Abnormal gonadotropin secretion, double mid-cycle peak of LH. Luteal phase defect. Luteinized unruptured follicle syndrome. هسه نجي الهيستولوجي. Microscopic pathology للendometriosis. Endometriosis is composed of endometrial glands and stroma with hemorrhage or hemosiderin-laden macrophages. Peritoneal deposits. Active lesion is considered when there is typical glandular epithelium with active proliferation and some secretory changes in later part of the cycle. The brown or black color depend on the amount of cellular debris. يعني هذا اللون اللي راح نشوفه مع الانdometriosis يعتمد على الcellular debris in the lumen of the gland and also hemosiderin. hemosiderin راح نشوف اللون مالته فنعرف هل هذا هو brown or black color or red color. The ovary is a favorite site because of increased level of gonadal steroids compared with general circulation. دائما أغلب شيء نشوف الأوفري هو أكثر مكان يصير به الانdometriosis. ليش؟ لأنه عنده increased gonadal steroids. Endometrioma are well demarcated cysts filled with viscous chocolate-colored fluid epithelial lining. هذا السيست يسموه كيس شوكولاتي أو شوكولات سيست. الانdometrioma إيش راح نشوف؟ راح نشوف هو سيست ويا viscous chocolate-colored fluid. Lining may resemble endometrium but later on become flattened or cuboidal, perhaps due pressure atrophy. Peritoneal fluid environment in endometriosis. The volume is adversely affected by endometriotic tissue, increased concentration of macrophages, highly phagocytic to spermatozoa, راح تكون الماكروفاج. Increased secretion of prostaglandin F2 alpha and its metabolites probable cause of dysmenorrhea هو يسبب لنا اليوتراين contraction. شو نسوي diagnosis؟ أهم شيء طبعا عندنا دائما الساين والسيمتومز بالبداية. symptoms may be asymptomatic أو إذا symptomatic أول شيء راح تجينا به هو البين. The classic symptoms of endometriosis is crescendo type. يعني شنو؟ يعني dysmenorrhea before, increased during and persist after the end of menstruation. يعني راح يصير البين بس ما راح يروح، راح يبقى لحد نهاية المنستريشن حتى بعد المنستريشن. It may be due to stretch of the cystic spaces by accumulation of blood during menstruation, prostaglandin production, tissue damage and fixity of organs by adhesions. بعد عندنا شنو؟ dyspareunia اللي هي شنو؟ deep pain due to involved uterosacral ligament مثل ما قلنا بالبداية. rectovaginal septum, ovaries نشوف fixed rectovaginal adnexia راح نشوفها fixed وما راح نشوفها non-mobile. Infertility due to ovarian and tubal adhesions in moderate and severe disease. Small deposits cause infertility due to associated anovulation. Disordered ovum pickup, tubal motility or sperm phagocytosis, all these due to abnormal tubo-ovarian environmental milieu, either at immunological or prostaglandin bias, luteinized and ruptured follicle syndrome, luteal phase defect, and early pregnancy failure. Other symptoms related to sites of implants ممكن عندنا reproductive organs, dysmenorrhea, lower abdominal pain, pelvic pain, low back pain, and menstrual irregularity. GIT شو راح نشوف عندهم؟ cyclical rectal bleeding, cyclical diarrhea, cyclical tenesmus, and cyclical constipation. urinary tract راح نشوف عندهم cyclical hematuria, cyclical dysuria, cyclical urethric obstruction. lungs راح نشوف عندهم cyclical hemoptysis, surgical scars بالumbilicus, cyclical pain and bleeding that means cesarean section scar, endometrioma. يعني مريضة تجي تقول أنا مسوية عملية cesarean section لكن كل شهر يصير عندي bleeding أو كل شهر يصير عندي pain. رأسا يجي وتقول لكم قريب المنس، قبل المنس يبدي بأيام ويزيد خلال المنس ويبقى بعد المنس. يعني شنو تفكرون رأسا بالاندومتريوما؟ Clinical examination may not detect any abnormality. Physical signs are non-specific but suggestive. Inspection of vulva, vagina, and cervix for signs of endometriosis. Pelvic examination, tender, PV, tenderness, and nodularity of cul-de-sac, or rectovaginal septum, or uterosacral septum fixed. Rectovaginal septum or adnexia fixed. rectovaginal pouch يعني نشوف هاي rectovaginal part راح نشوفها جدا راح يصير بي fixation وموبايل and ovarian cysts راح يصير عندهم. شوفوا هذه تاري سبوتس endometriotic spots. هذه هنا red blood تكون red in color وهاي dark in color. During laparoscopy, the gold standard for definitive diagnosis with histological confirmation هو اللابروسكوب. هو الجولد ستاندرد للإندومتريوسيس. Typical powder burn or gun shoot lesions on peritoneal surface. At first it is pink, red, and then brown black when white plaque of collagen called lesions. then white plaque of collagen called lesion يعني راح تبدي بالبداية تصير typical powder burn or gun shoot، يعني هذه مالت السلاح اللي هو طلق يسموه طشاري، راح تشوفون بالضبط هيجي هذه منتشرة، هذه مال gun shoot. في البداية راح تبدي رد، وبعدين راح تصير شنو؟ تتحول إلى دارك، بعدين من يصير fibrosis تتحول إلى white lesion. Scarring and adhesions between mobile organs, for example uterus, broad ligament، هذه من يصير مكانات بها endometriotic tissue راح يصير adhesion, infection, bleeding, adhesion, infection. Scarring and adhesion between mobile organs, for example uterus and broad ligaments. Subtle forms include white or opacification of peritoneum, red flame-like lesion, glandular excrescence, sub-ovarian adhesion, coffee spots, and circular peritoneal defects. Ovarian endometriosis. Superficial implants راح نشوفها على السطح مالت الأوفري like other peritoneal implants. Large endometrioma filled with chocolate colored fluid، راح نشوف large endometrioma. Non-invasive methods اللي هي imaging techniques. Ultrasound can detect endometrioma, specifically transvaginal ultrasound, computerized tomography, CT scan and magnetic resonance imaging. Serum markers اللي هي non-specific markers CA 125 أو CA 125. It is a non-specific tumor marker that can be elevated with other pathological conditions, particularly ovarian carcinoma, significantly higher in women with moderate or severe endometriosis. Serum levels in excess of 35 units per mol used as a cutoff value. Classification. Revised American Fertility Society. The most recent widely accepted classification, it uses 4 categories اللي هي stage 1 minimal, stage 2 mild, stage 3 moderate, and stage 4 severe. Based on the degree of involvement of peritoneum, tubes and ovaries lesions are categorized as active endometriosis and adhesion. Points 3 and are assigned based on the dimensional spread into categories 1 cm, 1 to 3 cm, and 3 cm. This classification is important in counseling and in determining the treatment approach. Another simple classification is minimal coloration, minimal adhesion, mild adhesion, small implants, moderate, large endometrioma, and severe distorted pelvic anatomy. The treatment of endometriosis. Treatment is individualized according to our patient age. مهم عندنا wish for fertility، يعني مثلا مريضة قلنا لها يابا انتي رادلج medical treatment، أو مثلا مريضة قلنا لها انتي رادلج مثلا surgical treatment. نعتمد على من؟ نعتمد على patient age والwish for fertility. Okay. Severity of symptoms. Extent of disease. The goal of treatment should be to eliminate endometriotic lesions and more importantly to treat sequelae, pain, infertility often associated with this disease. The prophylaxis, prevention, early marriage and pregnancy. Pelvic examination should be gentle during menses. Examination under anesthesia before, not after the ANC. Use of tampon, especially with narrow introitus, should be avoided. Tubal insufflation, hysterosalpingiography, cryosurgery, electrocautery, and conization are contraindicated during and after and before menses. Avoid coitus during menses. irrigation with sterile saline at the end of operation, periodic examination 6 to 12 months, and oral contraceptive pills as contraception for genetically susceptible women. الactive treatment is a surgical treatment, usually the least invasive and most conservative surgery, especially for patients who desire preservation of reproductive function. So laparoscopy used in most women to decrease cost, morbidity, and recurrence of adhesions. Laparotomy is reserved for those with advanced disease in whom fertility is no longer necessary. Conservative surgery عندنا الأيم conserve healthy ovarian tissue as possible, restore pelvic anatomy. Endometriotic implants can be removed during laparoscopy with bipolar coagulation, laser minimal tissue damage, vaporization of superficial ovaries, lesions. A small ovarian endometrioma less than 3 cm is aspirated, irrigation and inspected for intracystic lesion, and the interior wall can be vaporized to destroy its mucosal lining. Large endometrioma less than 3 cm عفوا هنا تكون more than 3 cm خطأ هنا بس بالكتابة بس أصححها لكم should be aspirated, then incision and removal of cyst wall from the ovarian cortex. A radical surgery for those with severe symptoms, no desire for fertility, other treatment failed, total abdominal hysterectomy with bilateral salpingo oophorectomy, along with resection of any endometriotic lesion as completely as possible. The medical treatment: combined oral contraceptive pills, 1 pill per day for 6 to 12 months, used to induce pseudo-pregnancy caused by amenorrhea and desexualization of endometrial tissue. However, it is not definitive therapy, and reactivation occurs in most patients following termination of treatment. Leprogestins also induce a state of pseudo-pregnancy when used continuously. Use derivatives of progesterone or 19-nortestosterone. Medroxyprogesterone acetate is the most commonly used, and levonorgestrel IUD can be used. Gestarinone 19-nortestosterone derivative. الدنازول اللي هو isoxazole derivative of 17 and ethinyl testosterone. Its mechanism of action: decrease mid-cycle gonadotropin, decrease ovarian steroidogenesis, block estrogen, progesterone, and androgen receptors in endometrium, decrease sex hormone binding globulin at free testosterone, induce endometrial atrophy by direct action. الدوز عندنا 400 إلى 800 ملغ according to induction of amenorrhea and tolerance. The side effects عندنا weight gain, acne, oil skin, muscle cramps, and mood changes. Less commonly صار عندهم hirsutism, depression, hot flash, skin rash, and depending of voice, change in liver enzymes. From patients discontinue treatment if they develop hirsutism, skin rash, or deepening of voice. The contraindication: pregnancy, liver disease because it metabolized the liver, congestive heart failure, impaired renal function. هسه بعد عندنا شنو؟ الGnRH agonist. Mechanism: pituitary downregulation lead to decreased ovarian steroidogenesis and eventually pseudomenopause. Agonists used are leprolid, gozerlin, etc., given subcutaneously, IM, or nasally. Side effects due to hypoesthonism, hot flush, vaginal dryness, decreased libido, and osteoporosis. usually المالتيبارا هسه نجي على adenomyosis اللي هو شو نسميه internal endometriosis. Usually المالتيبارا in 4th decade of life. Etiology. The most acceptable theory to explain adenomyosis is the Collins diverticular theory that may be encouraged by hormonal imbalance, hyperestrogenemia in such age category. Pathology. Uterus is symmetrically enlarged or asymmetrically enlarged. Localized adenomyosis. Rarely exceeds 10 weeks. Adhesion on the surface peritoneal irritation by ectopic endometrium will occur. الكات section ايش راح نشوف بيه؟ راح نشوف tiny cysts small and few filled with altered blood endometrial glands distended with blood surrounded by fibrous tissue. Secretory activity in glands 10 to 30% and uterine activity is enlarged and endometrium is hyperplastic. Symptoms. شوفوا هذا هذا الادينومايوسيس. هذا تشوفوا كله هاي النقاط الحمر. Confirmed uterus. Symptoms. A premenopausal bleeding or menorrhagia. Pelvic congestive symptoms. Congestive dysmenorrhea, pelvic pain, leukorrhea. Signs. راح نشوف اليوترس standard on examination. Symmetrically enlarged or rarely symmetrical. Investigations. Sonography, preferably by transvaginal ultrasound. Other causes of symmetrically enlarged uterus. Differential diagnosis. Fibroid adenomyosis has no capsule and produces diffuse enlargement of uterus. However, fibroid is capsulated and usually asymmetrical uterus. The treatment here, total abdominal hysterectomy and bilateral salpingo-oophorectomy, is the definitive treatment and include the diagnosis with certainty. Thank you very much. Note, in women approaching menopause, progestin may be given for menorrhagia and non-steroidal anti-inflammatory drugs for dysmenorrhea, hoping for resolution of the disease or resorption of the disease after menopause. Still sunflower present. Thank you very much.